How to pass your NCLEX. 5 common reasons why you are failing. First, you have to know how the exams will be scored. It's very important. You cannot take exams to know that you don't know how they're going to score you. If you make a mistake in a question, it's your enemy. But if you get the right answer, it's your friend. And so time is your friend. You don't need to rush through the exams. You have enough time they've given you. If you calculate the 5 hours, you have at least 2 minutes to answer one question. So time is your friend. Time is your friend, and the wrong answer is your enemy. I will demonstrate and show you why time should be your friend. If this is the graph for the passing, and this is the passing level, you will start from here, and this is the passing level. If you answer one question right, you go like that, you go up. Another question, you keep on going up until you pass the passing level. All you need to do is to keep on staying there. You don't need to go up. That's an expectation. The NCLEX is designed that when you answer one good question, the next one is going to be hard. So every answer choice question that you answer right, they're going to give you a harder question. If you answer this right, you're going to get a harder question. So don't be surprised if you can't solve that one and you come down like that. That is okay. So far as you stay, as soon as you make mistake and you come down, they're going to give you one that is on the same level and let you stay there. Then if you're able to answer it, they will give you a harder question. That's why you see multiple starters, because they get harder as you answer. So for this person, if I get here, all I need to do one more. If I answer one more hard question, the next one, if I answer it wrong, I'll come here. They will give me something that at that level, so I will be able to answer it, then I go up. They'll give you something above. If I can't answer, I come down. So all you need to do is fluctuate, go up and down, up and down. And then if you remain this like that, you pass. So time is your friend. Okay, you don't need to use the whole 5 hours. Spend the whole 5 hours to answer 75 questions and still pass so far as you remain. But you're taking some chance, but it's possible that you can do that. And if you run out of time and you've answered 75 questions, you can still pass. They've given you at least, I think, 2 minutes if you calculate to answer one question, and you should be able to do that. So learn how they grade it so that you can plan towards that. So look at the study plan, what they're looking for, and the content level, and how they're going to grade you for that particular exams. And that is the key before even you start doing anything. The next thing is pathophysiology. If you watch all my videos, that is all what it's about. You cannot study medicine without pathophysiology. And all it means is know the why, okay? Why is this so? Every time you study any disease process, ask yourself, why is this so? If you keep asking yourself like that, then you start doing your critical thinking and apply it to any education question, risk factors, content level, teaching. That is all you need to do. For example, if you have an asthma patient like that, okay, you have to ask yourself, why do I have to worry about a beta blocker? Why? There is a reason why, based on the pathophysiology of the disease. Why should I worry about asthma patient on NSAID? Why should I worry about it? I mean, why should, if I give an asthma patient albuterol and his heart rate goes up to 110, I shouldn't worry about it? Why? Why, if an asthma patient come in and he's not wheezing, he has a silent chest, why should that be an omnion sign? And why would that be a priority? I have to call the HCP to come and take care of it, the doctor to come and take care of it, because I'm worried about it, because I need to prioritize this patient first. That is the why. So when you study everything, try to keep on asking yourself why. And the why is when you're doing that, you're going through back to your pathophysiology. Oh, this is why, this is the underlying problem. That is why I have to worry about it. So don't let go that phenomenon, and that will keep you thinking, and you'll be able to answer most NCLEX questions. It's about why and the reason, but they don't tell you that. And the next one is you study in vacuum. This is why you fail. You read all your infectious control. You spend a week. Then the following week, you're reading pharmacology. You're separating body system. Our body doesn't work like that. Our circulatory system connects to most every organs. It's a system. Our body work as a system. They don't work in isolation. Everything is interconnected. So you cannot just study one subject and say, today I'm doing pharmacology. Then when you go and do mental health and you see the same medication, you don't know why. You got to connect those together. When you're doing mental health, you just connect it to any system that is affected with that problem. And I will give you an example how this is very beneficial. So if you take the liver, for example, okay, so let's say we have our liver here. You ask yourself, draw arrows. What can happen to the liver that it will ask me at all? Well, you can have cirrhosis of the liver. Really? Right. Cirrhosis of the liver. What is that? Well, the liver has fibrosis, and when people have cirrhosis, where they can have high level of ammonia, and what would they develop? Encephalopathy. That's your prioritization question right here. Then what do? Your pharmacology come in. Then I have to give this patient lactulose. You see what I've done? Cirrhosis. Well, the albumin is low. What happened? They develop ascites. How do I treat it? Well, pharmacology. Spironolactone. Really? And spironolactone, is a potassium sparing. So your teaching start coming down. So I'll put spironolactone and I have to do some teaching about potassium. You see, one thing we're going back to pharmacology back and forth, right? And so the same thing, you come to the liver, you have your coagulation factors affected. So their INR is high and their PT is high. Guess what? This is where you're teaching your risk factors and your education, your intervention, SATA question is coming from about bleeding. All this, what do you need to tell the patient? What they need to do? That is where it's coming from. Guess what? The same liver, I got to worry about some medication, TB medication. I got to worry about Tylenol. I even have to worry about cholesterol medication, statins. There's a bunch of medication that affect the liver. And therefore, if I'm on this medication, I have to worry. You see, the system, I'm connecting pharmacology to that based on the pathophysiology of the liver if it's affected with cirrhosis. Right? Guess what? Infections control. Patient with a B, that's your infection control right there. It will do the same thing as alcohol causing cirrhosis. So don't study in vacuum. Like when you study a body, study like a body system. You study in a body system. Don't, when you do cardiovascular, just don't do the heart failure. Just do all the medication, all the pharmacology, all the teaching, how it connects to the respiratory system and the rest of the body. The whole thing will make sense, and your why will be easy. And guess what? Question type and expectation. Everybody think you listen to your friends. Oh, I finished. You go online, YouTube. or wherever you go, I finished 75. How I can make you finish 75? Who cares about 75 questions? Whether you answer 145, 142, 140, 130, it's an exams. That's why they have adaptive. This is where you can get it to. Answering 75 is not the litmus test to pass NCLEX. You can pass it so far as you've answered adequate amount of questions. And then 76, you're still going, and then you start losing hope. You start losing focus. The idea is to distract you. That's why there's a lot of questions. I've taken a bunch of medical board exams. Some of them are like 250, 300 questions, 6 hours. You're sitting down. Some of them is 8 hours. Board certification, 8 hours. Sitting, taking exams for 8 hours. You go crazy. But it requires stamina, focus, and critical thinking. So expect to answer the question. We don't have the chance to answer 75 and pass. You have to answer every question right. Every question you have to answer it. The more you answer, the more you get credit for. So it's different from what you guys take. So spend the time, take your time, whether it's the computer stop at 75 or not. Keep on going. Use the same energy. If after 75 is still going, take a break, regroup, and your mind recharge and come and tell yourself, every question I'm going to kill that question. I'm going to like hammer that question. I have the opportunity to take over that question. You tell yourself, this is my chance, and every question I can take control over it and solve it. Don't let that question now become your stumbling block, because now you said 75. Why is the computer not stopping? Instead of using that single brain cell to think about each question, you are not thinking about the computer not stopping at 75. That will not provide any you benefit. So don't worry about it. The reason why you have 75 is this. Okay, a 145 question is this. There's a different level of questions. There's a content level question. Okay, there's 3 types. There's a prioritization question, and then there's a SATA question. The SATA is divided into 4. So you have the risk factors, the education, the teaching, and the content level. So that's why the exams is like that. So tell yourself, well, I may get probably like 30 content, prioritization, maybe 60, and SATA the rest of it. Okay, so this is 90, SATA probably like 60, 50 or 60 questions, and this is divided among this. If you think like that, it's easy. Whenever you see a question, okay, let me put it in content. I have 30, I'm waiting for 29. So you compartmentalize in your brain. This is the way I'm breaking it down. Forget about 145 question or 75. See each question worth the same. Even though they give you 15 questions, that doesn't count. You don't know. So treat each question as one of your questions that will be counted towards you. And don't worry about this 75 that you see it everywhere. Don't do that to yourself. 75, nobody cares. Whether you answer 120 questions right, your license doesn't say 70, 120. It said you pass. You've done the good work. Don't let that 75 everybody do to disturb you. So I finish in 75. And so what? It doesn't matter. Okay. So that is my spiel about this. And the last one. This is the number 1. This is what kills people. You assuming you take your test and you fail. So this is for somebody who's failed before, and you get your exams. They don't tell you. They said near passing, higher passing, low passing, below passing. It doesn't matter. And so you look at it and say, oh, okay, I need to study more pharmacology. I need to study more infections control. So you spend your 6 weeks studying that, and you forget about the other segment, other portion of the test. You forget about GI, you forget about vascular because you did well on the previous test. And so you spend time mastering pharmacology. Guess what? When you go back, go to the study plan, there is distribution of tests. They have distribution. You have to know the distribution. They have managed care, they have pharmacology, physiological adaptation. You're going to get the same distribution for each test. The test that you took previously is irrelevant because it's a computer. It gives you the questions based on your ability, what you're doing. It's a random setting question. You can go and all you get was most of mental health. Mental health can be so many things. You can get mental health in prioritization. You can get mental health in pharmacology. You can get mental health in content level. You can get mental health in education. So they can use the same one system and just use it to solve the whole question. So don't worry about the results they give you. It's a formality. You go back and you regroup and get yourself back in shape and try and tackle this again. And how do you tackle it? I think the bulk of your exams, in every exams in our body, these are the things that play a role. Cardiovascular. So start with cardiovascular. Learn it really well. Look at the EKG, heart, all the heart functions, everything about cardiovascular. You should start with this. Master it well, followed by GI. These are the pillars of your exams. These are pillars of NCLEX. Pillars, okay? Pillars of NCLEX. If you master cardiovascular, followed by GI, respiratory, guess what? These are the 3 pillars that form delegation and prioritization. When a patient comes in and says, who do you see first? It's all about, most of them have cardiovascular problem, they have gastro problem, they have respiratory problem. That's what we do, the ABC. This is the secret. If you master this cardio, gastro, and respiratory, all your prioritization questions, you've seen this. You know what, when a patient asthma is have certain symptoms, is a prioritization patient. So they will put it there. When somebody has a GI like interception, when you see something that is abnormal, it becomes prioritization. Like pyloric stenosis, when the kid is dehydrated, is prioritization. All these prioritization questions, look at it carefully. 95% of them talking about cardio, gastro, and respiratory. And so when you master this, you cannot do well in prioritization, delegation, assignment if you have no clue about the content level of cardio, gastro, and respiratory, using them critically. Once again, you can do well in prioritization question, delegation, and assignment if you don't know your cardio, gastro, and respiratory well, so that you can know which one is a priority finding, and you can critically answer the question. Then when you finish, you go to safety and infection control. These 5, if you get it well, then you read the rest of the other topics. But spend your time on this. Spend bulk of your time mastering this. Then you try to pick, mental health, I forget to add, mental health is also one of the big part. But finish with this, okay? Then you come to mental health. So you go and pick gastro, cardio. So start with cardio, gastro, respiratory, and look at the Q banks. Most of the Q banks, look at how many questions you have on cardio. Go to Archer and look at how many questions they have on cardio. And what will be the second one? It will be gastro. The third one will be probably respiratory. And then prioritization, because the prioritization is everything. And infection control and mental health are like sharing. The same thing you with all the Q banks, because it's a body system. But most of our body system, cardiovascular prayer, it connects to a bunch of them. And there's a bunch of disease process in the cardiovascular system. So this is the key for your exams. Know your grading level, know your pathophysiology, don't study in vacuum, know the question types will come in, and then your results. Don't look at that results if you failed before. If you never taken the exams, start with these 5 pillars: cardio, gastro, respiratory, prioritization, safety. Then go and get your mental health and the rest of the topics you need to know. You have to study all of them, but these pillars, you got to get it. It's your foundation for the success. So why are you failing? It's because you're not doing what you're supposed to do with these 5 pillars. I hope this helped you. You can do it. This is doable. And good luck. Keep charging. All the best of luck. If you like this video, subscribe to my channel and get more updates. All the best of luck.